When your test results say normal, but your body screams otherwise, well, it's definitely not in your head. Let's find your way forward.
Welcome to this deep dive.
Yeah.
Yeah, today we're tackling something really common and honestly often quite frustrating.
Mm-hmm.
That experience of feeling persistently unwell, despite medical tests, consistently coming back saying normal.
Exactly. And so many of you listening probably know this feeling way too well.
Yeah,
That just relentless fatigue or pain without a clear reason, maybe that brain fog that just clouds everything.
right.
We know lots of people are navigating conditions like, say, endometriosis or PCOS, where even getting the diagnosis is a huge journey.
A marathon sometimes.
Totally. And then there are those symptoms that just fall into that really vague category, medically unexplained.
And it's completely understandable that this whole situation can make you feel really isolated, full of self-doubt.
Oh, for sure.
Because when you're told again and again that everything looks fine on paper, it's only natural to start wondering, am I imagining this? Or is it me?
But that's exactly what we want to dig into today, isn't it?
Mm.
We're going to explore why those normal results don't always tell the whole story.
Yeah, and maybe more importantly, talk about some concrete steps you can actually take
Right?
to move forward, get some clarity, and really advocate for yourself effectively, even if there isn't a clear diagnosis right away.
Okay, so where do we start? I think acknowledging the emotional side is huge.
Absolutely. Let's start there. It can be genuinely maddening
Maddening is the word.
to be told everything's normal when your body, your day-to-day experience, is just screaming that it's not.
Yeah, and you can get caught in that loop, right? Thinking, is this just anxiety? Am I not handling stress well? Should I just push through it?
Exactly. Those thoughts are so understandable when your inner reality just clashes so hard with what the tests are showing or what you're being told.
But we need to be really clear here.
Yes, please.
No, you are not imagining this. You're not being dramatic.
Not at all.
What you're experiencing is real, even if the standard tests aren't sophisticated enough, or maybe just not the right tests to pick it up yet.
Precisely. That disconnect between your symptoms and your lab results, it doesn't invalidate your experience one bit.
And it really hits home when you hear how many people, especially women, share these stories.
Oh, it's so common.
Being sent home, feeling dismissed after getting that clean bill of health. It's emotionally exhausting.
It really is. And it points to a genuine gap, I think, in how we sometimes approach these more complex or less visible health challenges.
You absolutely deserve better. You deserve to be heard and have your experience taken seriously.
You do. So let's maybe dig into why this happens. Why do some of these significant conditions stay hidden from those standard tests?
Okay, yeah, let's unpack that. Because it feels counterintuitive, doesn't it? If something's wrong, shouldn't a test show it? What are the main reasons?
Well, one really important factor is that a lot of chronic conditions, they just don't show up in ways that basic blood work or, standard scans can easily spot.
Okay.
Take endometriosis, for instance. That's a classic example.
Right.
Now, there's research ongoing into better diagnostic tools, non-invasive ones, hopefully, but right now, the gold standard often involves surgery.
Surgery, like they have to actually look inside.
Exactly. Laparoscopic surgery to physically see and confirm if there's endometrial tissue growing outside the uterus. A normal blood test. It's just not designed for that.
Got it. So it's about physical evidence, not a blood marker.
Okay.
Okay, what about something like PCOS, polycystic ovary syndrome?
Yeah, PCOS is what we call a syndrome,
Okay.
which means it's diagnosed based on a collection of signs and symptoms, not one single test result.
Ah, so it can look different in different people.
Very different. There isn't one definitive test. Diagnosis usually involves looking at the whole picture, clinical signs, what symptoms you report, sometimes hormone levels. But even those hormones can fluctuate or fall within what's considered a normal range on the chart. It's about the pattern.
So again, not a simple checkbox exercise from a lab report.
Sure.
Okay, what about conditions where pain is really the main thing, like fibromyalgia?
Right, fibromyalgia, that's characterized by widespread body pain,
Yeah.
often along with, significant fatigue, sleep issues, cognitive fog.
Yeah.
But the key thing here is it doesn't typically involve the kind of inflammation or specific biomarkers that show up on those routine blood tests for, say, arthritis.
So how is it diagnosed then?
It relies heavily on your detailed description of your symptoms, combined with a physical exam where a doctor checks for specific tender points on the body.
Wow. So it really shifts the focus back to what the person is actually feeling and saying.
Absolutely. The patient's voice becomes crucial in that diagnosis.
That's so important.
And, we see something similar with early-stage autoimmune conditions sometimes.
Oh, how so?
Well, the specific antibodies or inflammatory markers that signal an autoimmune process, sometimes they just haven't reached a high enough level yet to be detected by standard tests.
So you could be feeling symptoms.
For months, even years potentially, before a test finally comes back positive. It can be a really long and, frankly, frustrating diagnostic journey for people.
Gosh, that waiting and not knowing must be incredibly difficult. You also mentioned something about nutrient levels or hormones being technically normal, but still causing issues.
Yes, exactly. This is where it gets a bit more nuanced.
Okay.
See, those normal reference ranges on your lab report, they're usually based on averages across a large population.
Right, like a bell curve kind of thing.
Pretty much. But what falls within that wide range might still not be optimal for your specific individual body and its needs.
Oh, okay.
So subtle imbalances, maybe in key nutrients or certain hormones, even if they're not flagged as abnormal, could still be contributing to symptoms and affecting how you feel overall.
That really highlights how normal on paper isn't always the same as feeling normal, does it?
It really does. It's a key distinction.
Which I guess brings us to that term you mentioned earlier, medically unexplained symptoms, or MUS. It can sound a bit dismissive.
It can sound that way, yeah, but the intention behind it, at least clinically, is a bit different. The NHS, for example, defines it as real symptoms with no clear or consistent lab-based explanation.
Real symptoms, that's important.
Crucial. And they note it affects about 1 in 4 people visiting their GP. What's telling is that definition. It validates the symptoms are real while acknowledging the limits of current tests. It's not saying it's psychological, it's saying we haven't found the biological why yet.
Okay, that's a much better way to frame it. So let's just hammer this home. Just because it doesn't show up on a test doesn't mean it's not real.
Absolutely not. Your experience is valid, period. Whether it has a neat label yet or not.
Okay, so someone's listening, nodding along, thinking, this is me. They feel unwell, tests are normal, they know something's off. What can they actually do? What are some concrete steps to get clarity, maybe feel a bit more in control?
Right, the practical side. This is where you can really start to take back some power, one of the most empowering things. Become a really meticulous observer of your own body.
Like a detective.
Exactly.
Yeah.
Strongly recommend keeping a detailed daily symptom journal.
Okay, what kind of stuff should go in there? Has it just felt tired today?
Go deeper than that. Track the key things. Pain, where is it? What kind of pain? Aching, sharp, burning. Intensity on a scale, say 1 to 10. Your fatigue levels, maybe rate them morning, noon, night. Your mood. Any digestive stuff, bloating, discomfort, changes in habits. Sleep how long, but also how rested did you feel when you wake up.
Quality, not just quantity.
Exactly. And overall energy levels. The key is consistency. Do it daily if you can. Because over time, patterns start to emerge.
Patterns you'd totally miss just thinking back over a few weeks for a doctor's appointment.
Precisely. Trends, not just snapshots.
Yeah, makes sense. What else helps in this detective work?
It's also super valuable to track things that seem to influence your symptoms, both for better and for worse.
Like triggers.
Triggers, yes, but also things that help. So note down specific foods, big stressors, work deadlines, family stuff, your physical activity, sleep habits, obviously, even social interactions. Did arguing with someone make your pain flare? Did a quiet day help?
Gotcha. Looking for those correlations.
Yeah, sometimes small things have a bigger impact than you'd think.
Okay, so journaling, tracking influences. What about interacting with doctors? That can be a huge source of frustration.
It can be, but finding the right partner in your healthcare is crucial. It might take time. Don't get discouraged if the first few conversations aren't great.
So keep looking.
Yes, and be direct. It's okay to ask a provider. I know the tests are normal, but I'm still feeling XYZ. Can we keep exploring this together? What are the next steps?
Frame it as a partnership.
Exactly. You're looking for someone collaborative. And honestly, having just one validating voice in the medical system, it can change everything.
That feeling of being heard.
Yeah.
Yeah. What about support outside the doctor's office?
Hugely important. Connecting with other people who are going through similar things can be incredibly powerful.
Support groups, online communities.
Both. Finding communities of people with shared experiences, whether it's a specific condition or just broadly unexplained symptoms, provides emotional support, practical tips you might not have thought of, and just that vital sense of, okay, I'm not alone in this.
Yeah.
Sometimes that connection can feel even more important than getting a diagnosis right away.
Finding your tribe, people who just get it.
Exactly.
And is there like a mindset shift that helps people navigate this uncertainty?
I think the biggest one is learning to really, truly trust the signals your body is sending you.
Easier said than done sometimes when you're being told otherwise.
It is. But deep down, if something consistently feels off, it probably is. You live in your body 24/7. You are the expert on your lived experience. Your intuition, your gut feelings, your symptoms. Those are valid pieces of information, even if they don't line up neatly with a lab test right now.
That's a really powerful reminder. And actually, on that note, maybe a little prompt for everyone listening right now.
It's a good idea.
Just take a second, maybe pause after this, and write down one thing you trust about your body. You are your best advocate. It
Yeah.
could be your intuition, like you said, or maybe it's resilience, how it heals from a cut. Just something to reconnect with that inner wisdom.
I love that. And, as you're doing all this, the tracking, the advocating there, are tools that can actually help make it easier.
Right. Which brings us to the March Health app. How can something like that fit into this picture for someone dealing with these unexplained symptoms?
Well, the March Health app is basically designed to help you do that systematic tracking we were talking about, but in a really organized, easy way.
So instead of a messy notebook.
Kind of, yeah. You can log your symptoms daily, note the specifics, pain levels, energy, mood, digestion, sleep quality, any flares. Doing it consistently in the app helps build that picture over time.
And that helps identify those trends the basic tests might miss.
Exactly. It helps you see patterns. Maybe you notice your energy always dips after eating a certain food, or your pain flares up during stressful weeks. The app can help visualize those connections.
Okay.
You can track energy, digestion, mood, flares, and see how they might correlate.
So it essentially helps you organize all that detective work we talked about.
Precisely. It builds a detailed, objective record of your health journey. And that record becomes incredibly valuable when you talk to your doctor.
How so?
Because you can go in armed with data, not just vague feelings. You can say, look, for the past 3 weeks, my fatigue has been an 8 out of 10 nearly every afternoon, and it seems worse when I eat X. It helps you advocate for yourself with much more clarity and confidence.
So it's a practical tool for self-advocacy, really.
Absolutely. So if you are looking for a tool to make tracking easier, to see those trends, and to help you speak up for yourself more clearly, the March Health app is designed exactly for that purpose.
Yeah.
Because your experience matters. And we really want to help make sure it's never ignored again.
Okay, so let's kind of wrap this up. We've talked about this really common, often isolating situation, feeling unwell. But the tests say normal. And we've seen that normal on paper doesn't always mean you feel fine. Lots of conditions are just hard to detect with standard tests, or they don't present in ways that fit neatly into diagnostic boxes yet.
And the absolute key takeaway here is that you're still entitled, completely entitled, to seek answers, to seek support, and to get validation.
Yes, regardless of those initial test results.
Regardless.
So if this deep dive resonated with you, maybe think about sharing it with friends, family, anyone you know who's been told everything looks fine, but they just know something's not right.
Yeah, let's spread that validation.
Let's empower each other. And remember, your body's voice is powerful. It doesn't need anyone's permission to be heard.
So true. Until our next deep dive, stay curious, keep listening to your body, stay grounded, and really trust what you feel. Your story is still unfolding.
And you are definitely not alone in it.